everyone. Hello, everyone. It's great to be here today at the University of Ottawa Medical School. I was speaking earlier with some future health professionals. This afternoon, I worked with all 13 of Canada's premiers to tackle one of the most important issues facing Canadians, strengthening publicly funded universal health care across this country. For generations, public health care has been a core part of what it means to be Canadian. It's built on a promise that no matter where you live or what you earn, you will always be able to get the medical care you need. But right now, our healthcare system isn't living up to that promise. Les délais d'attente aux urgences sont devenus dangereusement longs. Nos hôpitaux et nos cliniques réduisent leurs heures d'ouverture en raison de la pénurie de main-d'œuvre. Il y a des millions de Canadiens sans médecin de famille ou d'infirmières praticiennes qui doivent se débrouiller seuls dans le système de santé. People are waiting too long for essential surgeries, and we're seeing a growing need for mental health care, especially amongst young people. Canadians deserve better. Notre pays est un leader mondial de la recherche dans le domaine de la santé. C'est au Canada que les opérations à cœur ouvert ont connu leur début, que l'insuline a été élaborée et que des découvertes sont faites couramment dans la lutte contre le cancer. Les soins de santé sont de calibre mondial, mais on a besoin d'un système qui fonctionne bien pour que tous aient accès à ces soins. The pandemic reminded each and every one of us just how important our health is. It also put enormous pressure on our healthcare systems and on our healthcare workers. And it made us take a hard look at the long-standing issues facing our healthcare. As leaders, we've come together to deliver tangible actions and outcomes today while building a more modern system to ensure results for all Canadians for the future. The provincial and territorial governments deliver health care with support from federal funding, which ensures that our collective commitment to the Canada Health Act is upheld. In fact, it's written right into the Canada Health Act that, as governments, we need to protect, promote, and restore the physical and mental well-being of residents of Canada and facilitate reasonable access to health services without financial or other barriers. To help ensure that, we're announcing that the federal government will be providing $198 billion in additional federal health funding over the next decade. This includes planned increases to the Canada Health Transfer and new funding of $48 billion over the next 10 years. Obviously, this is a major federal investment in healthcare. But we all know that money alone is not the answer. Each province and territory is facing different challenges. That's why we're focused on negotiating 13 distinct bilateral agreements that will respond to various situations across the country. This will make sure that real improvements are made and accounted for, particularly in 4 priority areas: primary care, healthcare workers, mental health, and health information and data. First, primary care, making sure Canadians have access to family doctors and nurse practitioners. It's about having someone you trust, who knows you, your kids, your parents, your grandparents, and who will make sure that everyone gets the right care and finds the right specialists. A family health team is there to be your entry point into the healthcare system, so it doesn't have to be the emergency room. La deuxième priorité est d'aider les personnes au cœur même de notre système de santé et de réduire les listes d'attente. Les médecins, les infirmières, les ambulanciers et ambulancières, les préposés aux bénéficiaires et tout le personnel de la santé ont tout donné pour les Canadiens pendant ces dernières années épuisantes. Ils étaient les héros de la pandémie et aujourd'hui, ils vivent encore beaucoup de pression. Quand ils n'ont pas ce qu'il faut pour faire leur travail, c'est tout le monde qui souffre, y compris les patients en attente de rendez-vous ou d'opération sur des listes d'attente qui s'allongent. On a besoin d'un système de santé publique robuste, avec les ressources nécessaires où la charge de travail est soutenable. Un système où les travailleurs ont du soutien pour rester en poste sans se rendre à l'épuisement. On a tous très bien appris que les conditions de travail dictent les conditions de soins que reçoivent les Canadiens. Third, we need to make sure that Canadians can get the mental health care they need. 1 in 3 Canadians are struggling. The good news is that more and more people are bravely putting their hands up and asking for help. But we need a system that can respond and help people when and where they need it. And that includes helping those living with substance use and addictions challenges. La 4e priorité, c'est l'information. C'est de mettre en place un système de santé du 21e siècle qui est connecté et dans lequel on a tous un accès électronique à nos renseignements médicaux. Un système où ces données peuvent être communiquées à nos fournisseurs de soins de santé, que ce soit notre pharmacien ou notre spécialiste, pour pouvoir recevoir des soins appropriés et de qualité. Each of the 13 bilateral agreements will be focused on delivering results for Canadians, to make sure that you're getting your hip replacement faster so you can have your quality of life back sooner. Pour s'assurer que si vous devez amener votre enfant à l'urgence, vous verrez quelqu'un rapidement. Pour s'assurer que si un proche aîné contracte une maladie évitable et traitable, son médecin de famille va pouvoir le recevoir avant que la maladie devienne plus grave. Bilateral agreements will be tailored and flexible to the needs of each province and territory. But one thing will be consistent. Each will need to provide transparent information so that your healthcare system is accountable and you can be sure that real improvements are being made. What gets measured gets done. No matter your income or where you live, you deserve access to the best possible care from coast to coast to coast, whether you live somewhere remote, rural, or urban. Indigenous peoples have their own unique health needs. They continue to face gaps in care at all levels, which are especially felt by those who require wraparound services. Every Indigenous person deserves equal quality and equal access to health care, free from racism and discrimination. So as part of the bilateral agreements, we will work with Indigenous leadership to address these issues and make sure there are measurable results. And we are providing $2 billion over 10 years to an Indigenous Health Equity Fund to support First Nation, Inuit, and Métis partners in closing healthcare gaps. Healthcare has always been a priority for our government. Since 2015, we've made major historic investments to support Indigenous health. In 2017, we signed health accords with all provinces and territories to improve mental health and addictions care, as well as home and community care for all Canadians. Pendant la pandémie, on a investi des milliards de dollars pour que notre système résiste à cette crise de santé publique sans précédent, en fournissant, par exemple, des tests et des vaccins gratuits. On a tous été témoins des tragédies dans nos centres de soins de longue durée, et ce gouvernement a agi en offrant un financement important et en poussant pour des normes nationales pour protéger nos aînés. L'année passée, on a lancé la prestation dentaire canadienne qui envoie de l'argent directement aux familles qui en ont besoin pour que près de 200 000 enfants de moins de 12 ans à date puissent recevoir des soins dentaires. Et on va de l'avant pour que les aînés, les moins de 18 ans et les gens en situation de handicap puissent avoir du soutien pour leurs soins dentaires avant la fin de cette année. Notre gouvernement croit que prendre soin des Canadiens, c'est une responsabilité fondamentale. À ce sujet, j'aimerais prendre un moment pour remercier nos travailleurs de la santé pour leur dévouement héroïque. Merci. Les dernières années n'ont pas été faciles, mais vous continuez d'être là, de faire des heures supplémentaires, de prendre bien soin de nous et des gens qu'on aime. Notre gouvernement veut alléger les pressions exercées sur le personnel dans toutes les provinces et tous les territoires en facilitant la mobilité de la main-d'œuvre à travers le pays. We'll be asking provinces and territories to recognize credentials Canada-wide so that our well-trained healthcare professionals can work wherever there is need, and to improve how we recognize foreign credentials so that skilled people who come to Canada can more easily contribute and reduce pressure on overworked staff. Personal support workers take close care of people and deserve to be fairly paid. That's why today we're investing $1.7 billion towards the goal of $25 an hour for their important work. But most importantly, in order to support Canadian healthcare workers, we're taking steps to keep our public system strong. This is a big country, built on big, progressive ideas. And few are more central to who we are as Canadians than the promise of universal, publicly funded healthcare. We all pay our fair share, knowing that, unlike a lot of places, we don't have to make the choice between paying the mortgage or getting a much-needed surgery. And we like to know that our neighbor doesn't have to make that choice either, no matter their circumstances. So when it comes to healthcare, we need to make sure to look out for everyone and leave out no one. We're taking action today so Canadians can continue to have trust in our public system. We know that cuts and austerity won't make us stronger and won't help Canadians thrive. We're investing in the well-being of Canadians and in a strong social safety net, not only because it's the right thing to do, but because it's the smart thing to do. Canadians deserve to know that every new dollar being announced today is exactly that, a new dollar that will go towards the improvements in healthcare that Canadians need. Because when people are healthy, when people don't have to go into unnecessary debt, when people can get timely access to healthcare before complications arise, all of it makes our economy stronger. On vient de passer des années difficiles. Les gens sont à bout, ils sont inquiets, et ils doivent pouvoir compter sur le système de santé qui les a rendus si fiers d'être Canadiens et qui est une des raisons qui a encouragé tellement de gens de choisir de s'établir au Canada. Now is the time to step up, to meet this moment, to do what it takes to reinforce the defining Canadian institution that is universal public health care. I have high expectations, but also reasonable expectations that in the coming weeks, not months, we will conclude bilateral agreements, begin flowing more money, and Canadians will start seeing real results. Let's get this done. Let's give Canadians the health care that they expect and that they deserve. Merci. I'm now very happy to turn it over to our Deputy Prime Minister. Chrystia.
I need a bit of a step there. Merci, Monsieur le Premier ministre. Durant la pandémie, 8 $ sur 10 dépensés pour soutenir les Canadiens et les entreprises canadiennes provenaient du gouvernement fédéral. Au milieu d'une crise qui ne se produit qu'une fois par siècle, c'est ce qu'il fallait faire. Cette approche a permis aux Canadiens de rester en sécurité et solvables, aux entreprises canadiennes de se maintenir à flotte et aux provinces et territoires d'éviter que leur système de santé ne soit complètement submergé. Comme l'a noté une étude publiée par le journal de l'Association médicale canadienne l'été dernier, si le Canada avait eu le taux de mortalité lié au COVID des États-Unis, près de 70 000 Canadiens supplémentaires seraient morts. Nos dépenses d'urgence ont également jeté les bases de la remarquable relance économique que le Canada a connue après la pandémie. l'FMI prévoit que le Canada connaîtra la plus forte croissance économique de G7 au quatrième trimestre de cette année. Notre taux de chômage atteint presque un plancher record et en décembre, le taux de participation au marché du travail comprend une participation record de 85% de femmes qui sont dans leurs années les plus productives sur le plan professionnel, grâce à notre programme des garderies aux petites enfances. Grâce à la relance économique sans précédent que le Canada a connue après la récession qui a suivi la pandémie et que les dépenses fédérales d'urgence ont rendu possible, le transfert canadien en matière de santé sera majoré automatiquement en fonction du PIB de 9,3% cette année et de plus de 5% l'année prochaine. Ce montant ajoute auprès de 25 milliards de dollars en transferts annuels de points d'impôts fédéraux que nous versons déjà aux provinces et aux territoires. Depuis que nous avons été élus pour la première fois, notre gouvernement a également accordé des milliards de dollars en nouveau soutien pour les soins de longue durée, afin de réduire les retards et de veiller à ce que les Canadiens reçoivent les soins de santé mentale et les soins à domicile qu'ils méritent. The plan the Prime Minister put forward today delivers on the commitment we made to Canadians to strengthen publicly funded universal health care in our country. All told, it will deliver $198.6 billion in additional federal funding for health care over the next 10 years, $196.1 billion of which is to provinces and territories. Our plan includes $48 billion in new funding that we are announcing today, which is comprised of 5 different funding streams. First, an immediate, unconditional Canada Health Transfer top-up of $2 billion to address the real, urgent pressures in our emergency rooms, operating rooms, and pediatric hospitals. And this is in addition to the $6.5 billion in Canada Health Transfer top-ups that the federal government provided during the pandemic. Second, we will provide annual top-up payments to ensure provinces and territories who commit to improving health information see Canada Health Transfer increases of at least 5% per year for the next 5 years. At the end of those 5 years, the amount of the final top-up would become a permanent funding increase added to the CHT. Third, we will provide $25 billion over 10 years through a set of new bilateral agreements to ensure that every province and territory can address their unique health system needs. These investments will build on the $14 billion that we have previously committed to providing provinces and territories to improve mental health care, home and community care, and long-term care. Fourth, as we committed to do in the last election, we will provide $1.7 billion over the next 5 years to support wage increases for personal support workers. And fifth, we will provide $2 billion over 10 years to an Indigenous Health Equity Fund to be distributed on a distinctions basis with First Nations, Inuit, and Métis to address the unique challenges Indigenous peoples face when it comes to fair and equitable access to health services. It is our clear expectation that the funding we are announcing today will not be used in place of planned provincial or territorial health care spending. This funding from the federal government is additional, incremental money to improve the health care Canadians receive. That is what we expect it will be used to do, and that is what Canadians quite rightly expect as well. Il s'agit d'un investissement majeur dans les soins de santé financés par l'État. C'est un plan grâce auquel les Canadiens vont profiter d'un système de soins de santé universel de calibre mondial, financé par l'État. Un plan qui signifie que nous serons là pour les travailleurs de la santé qui sont là pour nous. Un plan qui signifie que peu importe notre revenu, le métier de nos parents ou l'endroit où vous êtes né au Canada, vous recevrez les soins dont vous avez besoin. We're investing in healthcare because it matters to Canadians. It matters to our children, and it matters to our parents. And for millions of Canadians, a universal, publicly funded healthcare system is central to what it means to be Canadian. We also know that a strong and effective healthcare system is an essential foundation of our country's economic success. The latest proof of that came just this week from the Ontario Chamber of Commerce, with 46% of the Chamber's members saying their business confidence was being shaken by concerns about the healthcare system. Getting this right matters to Canadians, and it matters to our economy as well. So this is a necessary investment. It is also a significant investment. It comes on top of the significant and necessary investments the federal government made to support Canadians and the Canadian economy during the pandemic. And it comes at a moment when Canada also faces a once-in-a-generation imperative to invest in the clean economy of the 21st century, to ensure that Canada seizes this opportunity rather than being left behind. These two great imperatives, to invest in healthcare and to invest in the clean economy, come at a time of great uncertainty in the global economy. They come at a time of real fiscal constraint. Canada can afford to make essential investments in times of crisis and in times of opportunity because of our AAA credit rating and because of our country's proud tradition of sound fiscal management. As we make difficult choices in the weeks and months to come, we will be mindful of that tradition and we will continue to be guided by it. Thank you very much. And now it is my very great pleasure to turn the floor over to my colleague, our Minister of Health, Jean-Yves Duclos. Jean-Yves, à vous la parole.
Bonsoir tout le monde. Good evening, everyone. Comme le Premier ministre l'a mentionné, notre système de santé et nos travailleurs de la santé sont soumis à d'énormes pressions et les patients le sentent et le vivent à tous les jours. Cette situation nécessite des actions immédiates et collaboratives pour relever les défis actuels et à venir. Comme vient de le dire le Premier ministre, nous reconnaissons tous l'importance d'améliorer l'accès aux soins de médecine familiale, en particulier en milieu rural et éloigné, de soutenir nos travailleurs de la santé et de réduire les retards en chirurgie, y compris pour les enfants, d'améliorer l'accès aux services de santé mentale et de toxicomanie, et de moderniser notre système de soins de santé. On this fourth priority, let me clarify why we want to work together to modernize our health system. And that's because data saves lives. Better access to health information is essential for health workers to be able to provide safe and high-quality health care. Think about this for a few seconds. Imagine an emergency department, nurse or doctor, not being able to see what medication a patient takes, not being able to see or to access the results of previous tests a patient has undergone, or not being able to access the medical history of a patient. That's why we will invest in better data to support better health care and to support workers in the care they need to provide. In addition, helping Canadians age with dignity closer to home with access to home care or safe long-term care continues to be an area of common priority. Collaborative work is already underway with provinces and territories to help them support access to home care and long-term care through a joint investment of $6 billion over 5 years. Investing in these 5 areas of common priorities will help repair the damage caused by COVID-19 and prepare for the future. This being said, the province and territories each have their own unique circumstances. As such, they will have the flexibility to tailor their bilateral agreements to meet the unique needs of their populations and geography. Each bilateral agreement will need to reinforce common core principles. First, as per our shared responsibility under the Canada Health Act, governments must ensure that medically necessary services are provided based on need, not on the ability to pay. Governments must also ensure equitable access to health care services and that such access is supported by a strong public health care sector. Second, agreements will reflect our joint commitment to health equity and reconciliation with Indigenous peoples. We will work together to ensure Indigenous peoples across this country are able to access quality and culturally safe health services. Finally, we will also support better access for other underserved and equity-deserving groups, including Canadians living in rural and remote areas and those living in official language minority communities. Ces engagements sont importants pour prendre soin des Canadiens et de leur santé. Ces engagements nécessitent une collaboration solide entre les gouvernements. Et nous avons hâte de soutenir ces engagements encore davantage par les investissements majeurs annoncés aujourd'hui par le Premier ministre. Merci. Thank you. Miigwech.
On va prendre 20 minutes de questions, Monsieur le Premier ministre. On va prendre 20 minutes de questions. One question, one follow-up, 20 minutes of questions.
So what was offered today was essentially repackages the new spending over 5 years that you had promised in the 2021 election, specifically on healthcare, but had not yet budgeted. Can you explain to Canadians why you believe that's enough, given that the crisis in healthcare has significantly worsened over the last year and a half?
$198 billion in additional funding for healthcare over the next 10 years. $48 billion of that brand new money that we know is going to be needed in healthcare in the coming years to make sure people have access to a primary care doctor, to support our healthcare workers, to make sure we're getting timely and proper mental health care, and to ground the system in a modern way in data and information and make sure patients get the best possible care and see that right across the country. But we know despite this historic investment, it's not just about money. It's about making sure we're delivering real results for Canadians. That's exactly what we're focused on doing. I'm really pleased we were able to sit down with the premiers today, and I look forward to the conversations we're going to have over the coming days and weeks to make sure that Canadians feel these improvements in a tangible way as soon as possible.
I'm asking specifically about new funding and in the period of 5 years, which was what tracked to your election promise. Are you saying that this does go beyond your election promise from 2021?
We know that Canadians faced an extraordinarily difficult time during the pandemic. It demonstrated that our healthcare systems have gaps right across the country, even as extraordinary heroes stepped up in the front lines of our healthcare system to keep Canadians safe through such a difficult time. We saw that we need to do more to support them, to support the systems that keep Canadians safe. That's why this investment of $48 billion of new money for a total of $198 billion of additional funding over the next 10 years is something that's going to set our system for the better. We know there are immediate and short-term pressures on our healthcare systems, and that's where we're stepping up with immediate $2 billion worth of injection into our healthcare system. But we also know, we heard clearly from premiers, that a 5-year timeline simply isn't enough. They need to know that the federal government is going to be a solid partner for them as they hire more doctors and nurses, as they build new facilities, as they modernize their technologies. These are the kinds of things that provinces need to know. And that's why this announcement today that the federal government will be there in a big way to ensure better results for all Canadians over the coming years is so important.
Next question.
Judy Trin with CTV News. I want to focus in on your $48 billion of new funding. That's an announcement that will be made, it's over 10 years, which amounts to $4.8 billion of new funding each year. There seems to be a huge disconnect between that offer and what the premiers wanted, which was $28 billion new funding each year. Can you explain that disconnect and why you feel that your offer, what you are presenting today, is enough to sustain the health system?
Well, as you say, this is a significant injection of money into the healthcare system at a time where it's needed. We recognize that there is a need for money right now, and that's what the $2 billion that we're going to be sending to the provinces to help with pediatric care, emergency room challenges, backlogs and surgeries is going to make a real difference. But on top of that, that $48 billion of new money over the next 10 years, on top of, or as part of the total of $198 billion in additional funds that we'll be sending to the provinces over the next 10 years, is a huge amount of money. But we know that it's not just about money needed to improve our healthcare systems. We need better outcomes. We need better support for our frontline workers. We need better infrastructure. We need better data. We need better access to mental health care. We need flexibility on delivering services, some online, some in person, that we've learned through the pandemic. There is a need to really make sure that Canadians are feeling and seeing the improvements in our healthcare system. So on top of the money, that's what we're focused on as well.
Given that there is a huge discrepancy between what is being offered today and what the premiers had initially wanted, is this your final offer? In an interview with CTV, Premier Blaine Higgs said that he was told this is take it or leave it.
We want to get to work negotiating flexible bilateral deals with the provinces that are going to deliver more family doctors, deliver better and faster mental health care, particularly for young people, deliver on more support for our frontline workers, and deliver better health information and data that's going to ensure people get the best quality of care. This is significant amounts of money on the table, and we know the premiers have said they need this money to be able to ensure a strong healthcare system going forward. I very much look forward to rolling up my sleeves and negotiating with them right away on delivering this money as quickly as possible to help healthcare systems across the country.
So we don't misquote you, it is your final offer?
Prochaine question.
Bonjour, Marie Chabot, Johnson, Radio-Canada. La même question, en fait. Est-ce que c'est l'offre finale ou est-ce que vous avez encore de la marge de manœuvre pour en donner plus à des provinces qui pourraient avoir besoin de plus de financement?
La marge de manœuvre est dans les accords bilatéraux. On a regardé notre encadrement fiscal, on a regardé les besoins des provinces qui, actuellement, il y a plusieurs provinces qui sont en situation de surplus budgétaire, mais même à ça, on a fait une injection de 2 milliards de dollars de façon assez immédiate pour aider aux chirurgies qui ont été reportées, aux problèmes dans les hôpitaux pour les enfants, par exemple. Mais nous savons ce dont les premiers ministres avaient réellement besoin, c'est de l'assurance sur un plus long horizon. De savoir pour les 10 prochaines années, le gouvernement fédéral allait être là comme partenaire pour investir dans les choses qui sont vraiment importantes pour les Canadiens. Je sais qu'on a la mode quand on parle d'investissement en santé, de toujours parler de combien d'argent on est en train d'investir. 1 milliard ici, 100 millions là. Mais ce qui importe pour les citoyens, pour les familles, pour les aînés, c'est si oui ou non ils vont avoir accès à un médecin de famille. Si oui ou non, ils vont pouvoir à l'urgence et être vus en dedans d'1 heure. Si oui ou non, ils vont pouvoir avoir l'aide urgente pour leur santé mentale en situation de crise. Puis ça, c'est pas juste une question de dollars. C'est une question de travailler de façon intelligente en partenaire pour livrer ces services-là. Donc oui, nous sommes en train de faire une offre qui est l'offre qu'on a, qui rentre dans notre cadre fiscal, parce qu'on doit demeurer responsable, mais qui est assez pour pouvoir amener de vrais changements et de vraies améliorations dans nos systèmes de santé à travers le pays.
Donc, on comprend bien qu'il n'y aura pas plus d'argent pour les provinces. Il y a plusieurs premiers ministres qui ont dit qu'ils avaient gagné sur le côté des conditions, qu'il n'y en avait pas de conditions au final. Est-ce qu'ils ont raison? Et si oui, comment est-ce que vous assurez vraiment que les promesses que vous êtes en train de faire aux Canadiens, ils vont être livrées?
La proposition qu'on a mise devant les premiers ministres est ancrée dans les résultats concrets pour les Canadiens, dans la transparence, dans la redevabilité directement aux Canadiens. On sait que les Canadiens ont besoin d'avoir plus accès à des médecins de famille. C'est quelque chose que les provinces savent très bien. C'est quelque chose que nous allons nous assurer de livrer en partenariat avec les provinces, avec ces ententes bilatérales. On sait que les gens ont besoin de meilleurs et de plus rapides soins en santé mentale. Ces ententes vont s'assurer qu'on est en train de les livrer. Tout ce qu'on est en train de faire est ancré dans des résultats concrets pour les Canadiens.
Prochaine question.
Hi, Tessie Sanchi, Hill Times Research. I want to ask about mental health funding. It's basically lumped in with 3 other priorities under bilateral agreements that are still to be negotiated. There's no defined funding. Considering you say you have a focus on mental health, considering you promised a permanent mental health transfer in 2021, why this approach, and is the mental health transfer still in the works?
5 years ago, in 2017, we signed historic deals with the provinces, including investments in mental health over the coming 10 years. One of the things that we heard from stakeholders, from community members, from people having trouble accessing mental health care across the country was there needed to be more clarity around outcomes. There needed to be more transparency, more data collected around what services were being offered. So as we move forward with historic investments now with the provinces, we're also ensuring that there is a clarity and a transparency, including around mental health, which is one of the 4 pillars around which these bilateral deals will be created with the provinces. But on mental health, I'm not the best person to speak to it because we have an extraordinary expert with us here today. I'd love to invite Carolyn Bennett, our Minister of Mental Health and Addictions, to say a few words about how much mental health and our approach on mental health matters to Canadians.
Thank you, Prime Minister. I think it's been for 20, 30 years that I've been fighting for transformation in health and healthcare. So we actually need to build a system around everybody having a family doctor, which allows people to, and what these priorities are articulating is that if everyone has a attachment to a family health team with additional mental health and supports, that is their way of approaching the whole of the health system, and that is built into how we see the dollars for primary care and primary care reform. In the support for health workers, we know that mental health has to be part of healthcare workers' support such that they don't burn out and such that they've got the supports to be able to stay in their jobs. when it comes to mental health and substance use, we are going to make sure that we are measuring the kinds of wait times to community-based services and substance use services, but also be able to use the Canada Health Survey to say what are the unmet needs in mental health across the country. And then in terms of the data, as the Prime Minister said, we need that transparency and accountability and the ability to be able to share information in a secure and confidential way. We need to be able to know what we're doing and to be able to leave no one behind. I'm very excited about this approach, which integrates mental health into everything we do, as the Prime Minister said, as says in the second paragraph of the Canada Health Act. That's what we have to be able to do, to get mental health back in to our publicly funded system, and for us to leave no one behind and be able to make sure that mental health is health.
Next question.
Hi, Prime Minister. Taria Isri, Global News. Just to be absolutely clear on your answer, I'm going to repeat my colleague's question. Is this your final offer to the provinces? Is there wiggle room?
There are negotiations about to start with the provinces on how they want to make sure that they're hitting those 4 priority areas we're facing. We put forward the fiscal frame that the federal government has and the investments that we're putting on the table for provinces to do. Now, provinces have the flexibility of putting more money into primary health care, to putting more money of this into mental health, or more support for workers, or doing a lot more on data. But they have the flexibility to meet within this envelope their priorities so that Canadians all across the country get the best care. This is the offer we put forward on the table. This is the billions of dollars that are there for provinces, and we certainly look forward to working with them to be able to deliver not just that money, but those healthcare improvements to citizens across the country.
The premiers have expressed disappointment, though, so how realistic is it that money will start flowing in the next budget, given their dissatisfaction?
I know for a fact that a number of the premiers are looking at these billions of dollars that we're willing to put on the table to invest in improvements in healthcare systems, and we'll be moving quickly on this. Canadians know that we do best as a country when different orders of government roll up our sleeves and work together to deliver the right results for Canadians. Canadians need access to family doctors. Canadians need better and quicker mental health services, particularly for young people or people struggling with addictions and substance abuse issues. People need to see support for our frontline health workers who've been such heroes through the past difficult years, and people need to know that we need to have a system, a modern system, grounded in science, in data, in information that makes sure people get the best possible care exactly as they need it. There are billions of dollars that we're putting forward in new money for the provinces. We're just looking forward to working with them and delivering it.
Next question.
Hi, Prime Minister Rafi Boudjikani on CBC News. You're talking about governments working together. Doug Ford called this a down payment. It doesn't sound like you're on the same page at all. Is there any further room for negotiations of amounts and terms in this deal?
$198 billion in additional funds over the next 10 years. This is a massive investment in not just the present of healthcare, but the future of healthcare in this country. And it's something that is going to make a real difference. We know there are going to be increasing pressures in our healthcare system, but we also know that grounding it in access to primary care, proper support throughout the system for mental health care, proper support for our frontline workers, for health professionals who've been working too hard, and all of it grounded in facts and data and information that ensures the best possible system. That's how to build a stronger healthcare system, not just for today, but for tomorrow. That's what we're excited about.
And you didn't raise the issue of private delivery in this meeting, again, according to Premier Ford. Are you not concerned about this? Why didn't you talk about it? Any conditions at all?
don't mean to contradict anyone, but the very first thing I brought up in the meeting was the fact that defending the Canada Health Act, upholding the Canada Health Act and the principles within is an absolute non-negotiable priority of this government. We're a government that a number of times over the past years has clawed back money from provinces who were not abiding by the principles of the Canada Health Act. We won't hesitate to do that again. But the fact is, we are going to ensure that Canada's public universal health care system continues to deliver the best possible care to Canadians. It's going to take not just investments, it's going to take a strong framework, and that's exactly what we're sitting down to build with the provinces now. Une des premières choses que j'ai soulignées dans ma rencontre avec les premiers ministres, c'est l'importance de respecter la loi canadienne sur la santé. Les Canadiens comprennent que notre système public universel est une richesse incalculable pour notre pays. Et la capacité d'avoir les services de santé de qualité nécessaires sans être préoccupé par le besoin d'hypothéquer sa maison ou de s'endetter pour une chirurgie, c'est une fierté pour les Canadiens. Nous allons toujours défendre la loi canadienne sur la santé. Nous allons toujours nous assurer qu'elle soit respectée.
Dernière question.
Oui, Marco Belair-Cirino du Devoir, bonsoir. Avec 48 milliards de dollars supplémentaires en 10 ans, est-ce que les provinces vont avoir la capacité financière de régler tous les problèmes du système de santé?
Le gouvernement fédéral n'a pas la responsabilité de livrer les services de santé. On reconnaît que c'est les champs de compétences et c'est l'expertise des provinces. Et donc, nous allons nous asseoir avec eux pour travailler, pour s'assurer qu'en matière de médecins de famille, en matière de soins de santé mentale, en matière d'appui pour les travailleurs, en matière d'information et de données, ils fixent les cibles appropriées qui vont pouvoir améliorer de façon profonde et réelle les services de soins de santé offerts aux Canadiens. Nous savons que ces 4 éléments sont à la base d'un système qui fonctionne. Et nous savons que les 198 milliards de dollars en fonds additionnels pour les 10 prochaines années, dont, comme vous avez dit, 48 milliards entièrement nouveaux, vont aider énormément à livrer ces services.
Concernant les accords bilatéraux dont vous avez fait allusion, M. Legault, Premier ministre du Québec, a dit que la bonne nouvelle, c'est qu'il n'y a pas de conditions. Donc, M. Trudeau a été très clair avec moi. Si on souhaite investir 100% de l'argent dans une de nos priorités, on peut le faire. Même si on nous demande de partager les données, il n'y a aucune condition d'atteindre des résultats. Notre seule imputabilité, c'est face à nos citoyens. Est-ce que M. Legault a bien compris?
Ultimement, on a besoin d'un système qui fonctionne pour les citoyens. C'est les Canadiens, les Québécois qui vont juger de leur système de santé. En mettant de l'avant un système axé sur les résultats et les données, les Canadiens vont plus avoir à réfléchir « Ah, mais il a investi 10 millions de dollars ici ou 100 millions de dollars là ou 1 milliard ici », ce qui veut moins dire que « Ah, j'ai pu trouver un médecin de famille pour ma cousine. J'ai pu obtenir de l'aide pour cette crise de santé mentale que mon fils est en train de vivre. On a pu trouver un spécialiste pour ma grand-mère. » C'est ça les résultats qui préoccupent les Canadiens. Ce à quoi les Canadiens veulent, c'est qu'on travaille ensemble pour les livrer. Et ça, les accords qu'on est en train de bâtir avec les provinces sont ancrés dans ces résultats concrets pour les Canadiens, avec les données, avec les éléments qu'on va mesurer de façon ouverte et transparente. Ultimement, nous sommes tous redevables aux citoyens en tant que politiciens, et c'est à eux qu'on doit le meilleur système de santé possible. C'est exactement ce qu'on travaille pour livrer maintenant.
Merci beaucoup. C'est ce qui m'a fait la conférence de presse de ce soir.
Merci beaucoup tout le monde.